All right, I think I'll go ahead and start introductions. So we've got three presenters today, Bryan, Lyda, Christine Pisani, and Dana Gover. And Bryan Lyda is a cultivator of bold solidarity and wholeness who seeks to build a bigger we and more beloved communities. As an advocate, educator, and organizer, he invites people and communities with more privilege to show up for the justice and liberation of all. He has had the privilege of working at the intersection of violence and disability with incredible community partners for nearly 10 years. Bryan believes that courageous truth-telling, deep listening, and centering solutions on those most marginalized will guide us into a world where everyone can thrive. He chooses to take many paths in life and hopes at least a few of them are made of dirt. Christine Pisani has multiple family members with a disability and began working for people with disabilities as a college student at the University of Idaho in 1986. Christine worked as a certified nursing assistant in a nursing home during college and in numerous roles assisting others before coming to the Idaho Council on Developmental Disabilities in 1996. Christine currently serves as the executive director for the council. Her work at the council presents opportunities to work directly with people with intellectual and developmental disabilities, families, and policymakers statewide. She previously served as president of the Ada County Human Rights Task Force. She holds a Master's of Education degree in Special Education with an emphasis in public policy. She is also a graduate of the State of Idaho's Certified Public Management Program. Dana Gover is the ADA Training and Technical Assistance Consultant for the Northwest ADA Center, Idaho. Dana provides information, guidance, training, on-site interviews, and technical assistance on the ADA and civil rights laws impacting people with disabilities. She earned her certification from the National ADA Coordinators Training and Certification Program. Dana brings a unique perspective as she has had a disability since 1979 due to a car accident. Dana earned a BA in communication and a master's degree in public administration. Dana has provided training since passage of the ADA. She is a founding board member of the Idaho Access Project, a board member of the Consortium of Idahoans with Disabilities and Living Independence Network Corporations, and a member of the following: Fair Housing Forum, City of Boise ADA Accessible Parking Committee, Ramp Up Idaho Project, Medicaid's Personal Assistance Oversight Committee, and the National Council on Independent Living. So Bryan, Christine, and Dana's presentation is entitled Working at the Intersection of Disability and Domestic Violence. Very excited for this presentation. I will turn it over to our presenters.
Thank you all. We wanted to take a minute and just introduce ourselves before we begin our presentation. And I will start by telling you my name is Christine Pisani. I'm the director at the Council on Developmental Disabilities. We, like the Council on Domestic Violence, are an independent council. We are federally and state mandated, and you'll find a Developmental Disability Council in every state and US territory. And our mission in state government is advocacy, working on systems change within services, and also capacity building, which can mean we do lots of leadership development for individuals with intellectual and developmental disabilities and family members who have children with developmental disabilities. But we also do a lot of capacity building as far as trying to infuse best practice for our service providers within the state. And with that, I'll turn it to Bryan.
Thanks so much, Christine. Yeah, my name is Bryan Lyda. I work for the Idaho Coalition Against Sexual and Domestic Violence. I won't take too long, but we often get conflated with the Idaho Council on domestic violence and victim assistance just because our names are very close at the beginning. And so we are an independent nonprofit, not a state agency, but we do work with the Idaho Council. We collaborate with systems, government systems, healthcare systems, victim assistance programs, things like that. But we would be more in the realm of like capacity building, similar to what Christine shared, supporting anyone that would work with someone impacted by violence. And so largely that's our sexual and domestic violence member programs, but also like Centers for Independent Living that we'll talk about in a bit. And really anyone that would would be seeking to support someone impacted by violence. And then our other arm really is, we could call it movement building, prevention, violence prevention, if you're familiar with that term, working with young people in particular young people from communities who are most impacted by violence due to racism, sexism, homophobia, ableism, and all the oppressions that still exist in Idaho. And so won't go too much more into that, but just to differentiate ourselves, we often get conflated. And so that is the Idaho Coalition. And I'll pass it on to Dana. Thanks so much.
Bryan, can I just wait till my presentation? Because that's what I'm going to basically talk about.
That's perfect. That's perfect.
Thank you.
All right, back to Christine then.
Thank you. And I do want to say that it's a privilege to get to do this presentation with my two partners, because I have a lot of respect for both of them. And we worked together for many years. So I'm going to provide some statistics. And of course, my field of expertise is around people with intellectual and developmental disabilities. I've been working here at the council since 1996 and have spent a considerable amount of time with individuals with intellectual and developmental disabilities around the state, as well as family members. But one of the things that seems to be, I feel, at epidemic levels is that abuse, neglect, and exploitation, and when I say that, I'm talking about sexual exploitation as well as financial exploitation, are serious issues in the systems of services and support for people with disabilities nationwide, but I believe we have serious issues here in Idaho as well. Next slide. So we are discovering that there is an alarmingly high rate of physical abuse, neglect, and sexual victimization among those with intellectual and developmental disabilities, but only a very small fraction of these instances are the perpetrators convicted. Next slide. People with intellectual and developmental disabilities are not only much more likely to experience abuse, they are likely to experience repeated abuse. And this falls in line with everything that I know. I rarely meet people with developmental disabilities who have not voluntarily shared with me that they have experienced abuse, typically more than once in their lifetime. And one study estimates that 49% of people will experience 10 or more incidents of abuse. Next slide. More than 90% of people with intellectual and developmental disabilities will experience some form of sexual abuse at some time in their lives. And I know that in Idaho, one of the things that we're uncovering is this is an area that is seriously underreported for people with disabilities. And like the slide says, 15 to 19,000 individuals with intellectual and developmental disabilities are raped each year in the United States. And I would say that that probably is a very low estimate, because people don't understand how to report, sometimes that what's happening to them is not okay. And then oftentimes they're in situations where the support that is being provided to them can't easily be replaced. Next slide. Most incidents of abuse and neglect for people with intellectual and developmental disabilities are not reported. And we are learning here in Idaho that, and I've heard this so many times from individuals, that they didn't know what was happening was wrong. They didn't know to report it. They didn't know how to report it. And when they did speak up, they weren't believed. And this is consistent against most people with disabilities that I've spoken to in our state. And when this cites that this is especially true for people living in congregate settings, we have what we mean by congregate settings are things like group homes where people with developmental disabilities live, typically 8 people to a house. People are also living in assisted living facilities. And unfortunately, we have people with disabilities who are very young living in nursing homes, and that's also considered a congregate setting. We also have within the developmental system here in Idaho something called supported living agencies, and that is where 4 people can live in a home that they rent, and lots of abuse happens in those situations. Those can be resident to resident abuse as well as staff to resident abuse. Next slide, please. Can you go to the next slide, Bryan?
I think I did. Is it not showing up?
I have, okay, there we go.
There we go.
A study by the Boston Globe found that while 70% of serious crimes against people without disabilities were prosecuted, only 5% of serious crimes against people with disabilities were. And this just, I think, speaks to the fact that people with disabilities in general are invisible and oftentimes aren't viewed as contributing members of the community, so aren't valued. And so I think that's how this ends up being reflected. There's also the issue of being believed. And when you have a person who is nonverbal, we're discovering here in Idaho that oftentimes the perpetrator of the abuse is the one speaking for the person who is nonverbal. And you can see that that can be a real problem. So we have so many factors contributing to this low percentage of prosecutions when people with disabilities find themselves in these horrific situations. Next slide. And this, so people with more profound intellectual disabilities, and I'm just going to say significant disabilities. The more significant your disability is, the more likely you are to experience abuse or to be targeted for abuse and neglect. And this goes hand in hand with the fact that if you are a person who doesn't use speech to communicate, the likelihood of abuse goes up significantly. Next slide. Almost all abuse is perpetrated by someone that a person with a disability knows. Research shows that this could be 96% or more of the cases. And so just to explain how this works, in Idaho, the majority of people with intellectual and developmental disabilities live in something called a certified family home. A certified family home is typically the family member, typically the parents or the guardians of individuals, their sons and daughters. That is the predominant way people are served in our state. And so what happens is that we have a number of situations where it is the family member who is perpetrating the abuse. And if you compound that with, we live in a very rural state, we have huge pockets of our state that have no providers. So let's say, for example, an individual that I know of who lived in Montpelier, Idaho, was experiencing abuse, but there are no service providers in that part of the state. The family member is the provider. So if I report my family member, I have no one to help me get out of bed, help prepare my meals, help me get dressed, help me use the toilet, help me basically function in my life if I turn in my parent, because there's nobody that can easily slide in and take that role on. So these are the complicated issues we have to figure out in order to better serve the disability community, to help them get out of those situations and access a better way of getting support. Next slide. So between the years of 2002 and 2007, I was seeking leaders amongst those with intellectual and developmental disabilities statewide. So I was doing interviews all over Idaho. between these years, and I interviewed 108 individuals with intellectual and developmental disabilities. And of those 108 individuals, 82 individuals voluntarily shared with me that they had been abused at least one or more times over their lifetimes. Most reported they did not know who to tell or that anyone would be interested in listening. The other factor that I hear a lot from individuals with intellectual and developmental disabilities is if they seek counseling, if they make it that far in the system, they're often not believed. They're often told that they're making it up and that could have never happened. So you can see we have a whole lot of work to do to help prevent this from happening, but also to hold people accountable, and then also to help people heal from these situations where we have a high predominance of abuse happening to people with disabilities in our state. And at this time, I'll turn my time over to Dana.
Thank you, Christine. Just to cap a little bit about what Christine is talking about. I am a person with a disability. I was disabled back when I was 18 from a car accident, and I lived in a small rural community in Oregon. And I moved to Idaho because I came to rehab here. And shortly after I moved here, I was basically raped. And I was afraid to tell anybody because I was afraid that I would have to go back to Oregon to live and my family wouldn't want me to live on my own. So I do not, well, I guess I would be classified as having a developmental disability because I was, my accident happened before the age of 21. But, you know, people with physical disabilities to women, it happens very often. And it's a really, really hard thing. And I know from over the years when I've gotten calls from people, you know, we have a lot of, you know, to go to a shelter, it's not accessible. People are embarrassed. They blame themselves. So I just wanted to just, you know, explain that what, you know, we have statistics, but we also have real life examples. So what I do at the Northwest ADA Center is I do provide training and technical assistance. And one of the things that I can do is I can talk to you about how to make your shelter more accessible, or also do program access. We have connections all over the state through the Centers for Independent Living. We've got a Center for Independent Living down here in Boise called Link. I'm on the board of Link, and they can provide services to help you guys. Also, we have DAC, Disability Action Center Northwest, up in northern Idaho. And we also have Life over in eastern Idaho. Bryan, can you switch the slide? So what does the ADA cover? The ADA covers employment, which is Title I, state and local governments, which is Title II, and places of a public accommodation, with which most of you guys would fall under, which is Title III. Excuse me, I've got a frog in my throat. 1 second. And then Title IV is telecommunications, and then Title V is, you know, miscellaneous. Bryan, you wanted to go to the next slide? So the ADA, it guarantees equal opportunity for people with disabilities in places of businesses, employment, transportation, state and local government programs and services, and telecommunications. Next slide, Bryan. So regardless of the size of the business or the age of a building, most businesses that serve the public are covered by the ADA. That includes privately owned, leased, or operated facilities that affect commerce. Next slide. So some examples would be violence shelters, treatment facilities, including inpatient and outpatient facilities, safe and sober housing, drug and alcohol programs, hospitals, nursing homes, pretty much anything that you can think of would be covered under Title III. And I think that's about it. Does anybody have any questions about the types of businesses or anything about the ADA before we move on? Okay, go ahead, Bryan.
Thanks so much, Dana and Christine. There we go. So we thought we'd wrap up talking really about relationships and just model on that today as best we can. You know, Christine and Dana, just appreciate you both. No real way to move forward without these kind of partnerships. And so in the coalition, we use this line a lot, moving at the speed of trust, right? And so there's an old adage or whatever you want to call it, proverb. If you want to go fast, go alone. If you want to go far, go together. And so, and then I added the line in there, nothing about us without us. This is a line that really I've learned and embraced through partnering with the disability community, really thinking about a group of folks that over history have often been spoken for, have often had decisions made for, have often been controlled, coerced, harmed in so many ways. And so one of the principles really of all the work at the Idaho Coalition is that when we're ever working in community, that those communities are centered and have the decision-making power to move forward, right? So we'll kind of focus on that for now, and it looks like we will have time for questions at the end. And I know everyone will be really upset if we get done early, but so just a few stories of these are initiatives, you know, formal projects at the Idaho Coalition, but really some key learnings that have emerged over the years. We had a grant through the Office on Violence Against Women, and this would have been 7-ish years ago, 2014. And we had a 3-year process, and basically, you know, we just followed the grant mandate. We didn't like think too far ahead. And so we partnered with the State Independent Living Council, which was just an amazing experience. We learned though, like almost right away, that everything basically that we'd done for the last 15 years wasn't having the impact that we wanted. And so this process really was centered on meaningful change within the organization. You know, the coalition had done the trainings, we'd done the ADA trainings, we had the knowledge. That wasn't the problem. The problems that we were seeing arising, and by these I mean up to and including fair housing lawsuits against some of our domestic violence programs, against the coalition as the TA provider for these programs, because of things like high turnover in jobs. So we're training some folks, but we can't do a training every time we hire someone, or we're not having that information filtered down. We're training maybe the wrong folks that still need the knowledge, but aren't going to be on the front line serving folks with disabilities directly. And so through these, we call them learning communities, basically, like this collective learning process, where first we spent, months just learning about each other's agencies. You know, what did the State Independent Living Council do? What does the coalition do? Where are we both coming in at that intersection of domestic violence, sexual assault, stalking, and disability? So what I would lift up from that is the learning was great, but once we knew each other, and I mean, this sounds fluffy. I've been called Mr. Rogers more than once today, so feel free to throw it out in the chat if you want again. The relationships that we built through that were really the asset, really the big takeaway, the victory even, because anytime something came up after that process, you know, we had a face and a name that we knew, someone that we had lunch with, dinner with, these things. Would just shout out to Jamie Davis at the State Independent Living Council. She was a phenomenal partner in this process for, I think, last almost 4 years, because there was a slight delay in the middle. And also within that, navigating those tensions and conflicts that arise. That would be true for like all of these stories, especially talking about a community which in my mind has been ignored and marginalized as much as any other in our country, in our community, Boise, in Idaho, and all disabilities in general, and also specifically, I really appreciated, Christine, your information about developmental disabilities and folks marginalized in that way. And so, as you can imagine, there's some tension and even like borderline like anger there, right? Like if you are working with someone that hasn't been listened to for decades, right? There's some difficulties, right? There's some things. One thing I'd lift up too about relationships that we've learned is there's a real checklist box way to do this of like, oh, hey, we talked to the person with the disability, we talked to the person who is an immigrant, we talked to the person who is young or old, or, you know, a person of color or an indigenous person, and move on. I mean, that really tokenizing would be the word I'd use. Avoiding that at all costs. What does a meaningful relationship look like? And you can even use your own friendships as a human model, right? Big difficulty in Idaho, and Christine, you touched on this, especially particularly in our rural areas. It's often, even in Boise, often like the same folks that get asked to sit on like every single committee, every single collaboration, be it the LGBTQ community, disability. Gosh, Christine, I don't know how many committees you sit on for the Idaho Coalition and contribute to, and we're super grateful. But having an awareness about that, particularly in a rural community, burnout is real. Throw in Zoom fatigue right now. So making sure that we're honoring everyone's work and not just being in this like extractive place, right? Like tell us what to do, and we're not going to make any effort, but you need to basically give us all your knowledge, and then we'll give it a shot. Other big dynamic, and I know Christine and Dana were both talked about this, these things like focus groups and listening sessions are super helpful, super necessary if we're going to make the changes that we need to see in serving folks. But a deep commitment to results, right? Like if you have folks sharing these painful stories with you, right? Re-traumatizing energies in that, sharing all these, and then it ends up in that, you know, that little binder that is like called the strategic plan or whatever, and it doesn't ever come off the bookshelf again. I mean, that's a very real thing. And so insert that in there. But the Idaho Change Initiative was just a beautiful process, and really institutionalized some of the changes. I will never say the coalition is perfect, but you will see disability and that commitment in like every document that we have for our foundational organizing. You'll see it in our theory of change and in our practices. And I'll get to like budgets in a sec as we move forward, but every budget that we would write would have some sort of allocation for disability, whether or not we know we're going to need it, but just like making sure that we're as radically inclusive as we can be. I don't know if anyone's in the room for the Idaho Coordinated Response Journey breakout session led by Melissa Wintrow, I believe Leo Morales and Jen Martinez and Doug Graves were also on there. Not specifically focused on disability, but similar process, right? Gosh, we spent, I think, 6 months and on just getting to know each other, building those relationships up. So now if something arises, whatever community that we're trying to engage, like you would know the person. Again, this can be like kind of fluffy, but probably just the biggest successes we've ever had were from this practice. And so what the coordinated response did, if you weren't in that room, I believe yesterday, was really center community partners who were working with communities who have been marginalized, you know, disability, LGBTQ, the immigrant community, and pairing folks up with criminal legal system partners, you know, victim service providers, our domestic violence programs were represented there, and really struggled through a lot. Again, the tension is real, the conflict is real, My spiritual teacher always tells me, if you're not experiencing any tension in your relationship, you're not in a relationship. You're in a transactional connection, right? And so really beautiful work there about staying in the room when conflict is just going to be real, and all those human feelings that come up through that. Still in that process, still moving forward, but hopefully we move to that place of like co-creating solutions, right? Not this situation where we read a report and then write a new strategic plan or whatever it might be. Really want to lift up, lastly, our local sexual and domestic violence programs and the Centers for Independent Living that Dana mentioned. Lots of struggles there still, lots of, again, I mentioned fair housing violations, like that still happens unintentionally, and there's still just a lot of struggle. But the communities that we've just seen be the most successful, particularly in meeting the needs at that intersection of disability, are folks that knew their SIL, their Center for Independent Living, and not through their website, right? Through a connection with the case managers, the directors, even the advocates at our programs got out of that place of, oh, or this person has a disability, let's get on the website and do the, basically info at email address. It was like, no, call Carrie at DAC, call Susan at Life, and so, and then vice versa. Because what we realize is, particularly with communities that have been kind of pushed out of society, the organizations serving those communities are just as likely, if not more, to be the first person survivor or someone impacted by violence to reach out to. So what do we need to do together to build our collective capacity? And I just really love that, to like co-creating solutions, together in that intimate partnership. And so we'll move on for time, but this is a quick practice. Oh, yeah.
Oh, no, I'm sorry. I thought you were on your last slide. I want to share something when you're done, though.
If it's relevant to that, Christine, go ahead.
No, you can wait. Sorry.
And appreciate the comments in the chat. Thanks, Jonah. So this is a practice that we're about to enter into in our collaborative that I want to lift up from the Vera Institute of Justice. If you haven't been on their website, super amazing folks, not only centered on disability, but many communities and many just really bold solutions, both within the criminal legal system and beyond it, right? But this collaboration charter, it's a funny story if you were involved, but probably not for anyone else. It's like a checklist thing you have to do for some of these OBW grants that we receive. And when you have a collaboration, you basically write out, how you're going to make decisions, who eventually is like the end all be all decision maker, how do you manage conflict, who's at the table for how long, very formal. But what we realized was that the conversation that we had through developing this document, which is just a piece of paper, I honestly don't know where the last one we made even is. I could find it, but the piece of paper wasn't the victory. It was like, hey, those conversations arose where, we've been talking to you for 10 years and you haven't listened. So what's that about? How are we going to make sure that doesn't happen again? Really, again, tense conflict, but deeper relationships afterwards. I think particularly because our new collaboration is going to be focused on developmental disabilities and folks with intellectual and developmental disabilities. That's a conversation, that last bullet point. How are we going to make sure those voices are actually centered and not just going through the motions? Again, this is not new information for many of you, but can't really emphasize the importance of that. Other just quickly successes that we've seen in Idaho. My director, Kelly Miller, threw out this line to me a couple of years ago, and I've never forgotten it. Budgets are moral documents, which is hard for me to look at an Excel spreadsheet and see morals and values in it. But if we're not including that, we're making a statement to community about what matters. Budgets are how you share what matters in one way. And so I don't know everyone's funding streams, of course, but most grant applications now are requiring that, but making sure that when you develop those budgets, you are working with your partners from, it could be the disability community, it could also be things like language interpretation, working with your partners on that, so you know exactly what needs could come up. I didn't learn until 2 years deep into the previous disability initiative that we had that ASL interpreters came in pairs. And then the first presentation I saw, you can tell why, because you're going to get very tired after that long. So just making sure you're connected on that. You're noticing a pattern with the word relationships. I don't mean to just belabor it, but those pieces, both individual and organizational. So many times it's like the directors that talk, basically, which is awesome. But how do we have that filter down through the organization? And this just facilitates things like the cross training, right? That's helpful. Education, knowledge matters, but you're never going to know everything. And so you still are going to build this relationship where you rely on folks' expertise, the connection, the meaningful connection to community. And I mentioned this already at the beginning, but commitment's a vague word in many ways, but if we're not committed to the solutions up front, what are we doing, right? I mean, these focus groups, these reports that we read, these trainings, for example, that we come to, are not enough if we're not already committed to the solutions up front. And again, just words from my spiritual teacher, the commitment is always higher. The deeper the relationship, the higher the commitment. And so just to really end on that note, to show up for each other and move forward. So if you do plan on, whether you're coming from a domestic violence program, state agency, wherever you're representing today, if you'd like help with this, please reach out to one of the three of us. I'll pop up our emails in a second. If you need help, identifying who that is, the Centers for Independent Living are all on the website. Typically, Google shows up well if you need to make an individual connection. But if you need that kind of, what do you want to call it, covert conduit introduction, please reach out. We do really believe in this. And again, that's probably the biggest victory we've had in moving forward. The last part is, the deeper in relationship you are, you realize how much farther you have to go and how much work there is to do. And you're aware of things that you weren't aware of before. And so please reach out. Appreciate y'all being here. Christine, you had something to add, I think.
I did. I wanted to help everyone who's with us today understand that we feel like we need to understand what's happening better. So I actually saw Lane Gillespie's on this in this audience with us. And Lane is one of our researchers at Boise State University through the Criminal Justice Division. The DD Council is funding 3 separate years of studies to help us understand the reporting and monitoring of abuse, neglect, sexual and financial exploitation amongst people with disabilities. And we really want to understand better, what does the reporting look like? What does the outreach look like to people of color and people who are non-English speaking, people with disabilities? What's the follow-up? Because honestly, so far what we're understanding is that there's very little accountability to people with disabilities. So we are extremely excited to get these studies done and to learn from those studies, because we think if we could have some fact-based informed documentation, it will help us then go forward and actually try to help us put some recommendations together to move forward to improve the state for people with disabilities. The other thing is that Dana and Bryan are both part of a grant that we have from the Administration on Community Living. And the focus, one entire focus of that grant is around improving the reporting and monitoring systems for people with disabilities who experience abuse, neglect, financial and sexual exploitation. And so that work is really about centering people with disabilities and their experience and helping us to understand what their experience has been like in reporting, or understanding that they've never been given sex ed before, so they don't even necessarily understand their own bodies, what's appropriate and what's not appropriate, what their sexuality is. There's so many factors contributing to the amount of abuse that we're seeing for people with disabilities. People not understanding how to set boundaries, people not understanding what's okay, what should they expect from service providers, and then that odd place that people with disabilities often find themselves when their family members are the ones supporting them. And how do we, Bryan helped me learn this. This is why I value so much what he says about relationships matter, is this whole, the community coming up with a response that maybe in some situations we have to figure out how to mediate. How do we help families and individuals work through this situation? Because there may not be another provider, and maybe it's a lack of education that is really the barrier to understanding how I better support my adult son or daughter. How do I set boundaries with my parent? And Bryan really helped me to understand that. And so that's something that we really want to explore as an outcome of the current grant that we have, because oftentimes we look to law enforcement or legal routes to try and rectify a situation, when in fact, this sort of community resolution or community mediation platform might be a much better solution that we hadn't considered before. So I really like that he talks so much about the relationships, because it's absolutely true that once we get into relationships with with people that are different from us, or serve community in a different way, it really underscores how much we don't know and how much more we need to learn. And so I've been really grateful for that conversation as we explore that. And then the only other thing that I want to leave you with is that this is a powerful statement that I heard from a woman with autism who doesn't use words to speak. And her comment was, not speaking is not the same as not having anything to say. And I leave that with you, because so many people with disabilities maybe don't use words to speak, but they absolutely have things to say. And often we presume competence about people who don't use speech to talk. And there's just a lot going on that maybe we need to take a little bit more time to figure out through behavior as communication and just spending time with people, because most people are communicating things to us. We just have to stop long enough to pay attention.
Thanks so much, Christine. Dan, I just want to check in with you real quick if you wanted anything to add, or I'll jump to the next slide.
I just want to follow up by saying that, I work a lot with the Centers for Independent Living throughout the state. So if you would like a direct connection, just contact me and tell me what the issue is, and I can connect you with one of the, IL advocates or even the director. They're all really, really great people to work with. We also do some really great effective communication training. I think one of the biggest things about people with disabilities and myself that I find, it's not necessarily the physical barriers, it's more the attitude barriers. I know one of the biggest things that when I became a person with a disability, I was probably one of the first young people that I knew of myself, and it was my attitude towards myself. So sometimes, when you may meet somebody with a disability, we're just like anybody else. We have our bad days, our good days. Some people, not everybody a lot of people are not hooked up with a lot of the resources that all of us do. So a lot of people just don't know where to go. And you may be one of the first people that they reach out to. And it's so important. I can't tell you, you may make a difference between them reaching out to get help and not. But I just want to thank each and every one of you for what you do, because we need you guys out there. There's just so many places that people just don't know where to go. And with that, I'll turn it back over to Bryan and Christine and questions.
Yeah, we can keep talking to you, but I just, we can try this if we want. I'm not good at using the chat myself, so I'll just like own that. But if anyone wants to type a nugget into the chat that you want to like hold up that was really stood out for you, that you want to dig deeper into, please go ahead and do that. We'd appreciate it. And then if you have a question or a conversation that you'd like to explore further, go ahead and like type that into, and we can connect. So me type that in there, and then I can stop screen sharing in case people have live questions.
We also have lots of opportunities to be involved if you are interested in helping us explore solutions around the intersection of disability and violence in Idaho. Between the work that the coalition's doing, that we're involved with, Dana and I, and also the work that the council's doing, there's just lots of opportunities. And some of this stuff is difficult to figure out. So many minds make solutions easier. So anyone that would be interested, we would welcome you to be a part of helping us create solutions around some of these really complicated issues.
All right, we'll watch the chat for a bit, but I'll go ahead and pop up our emails in case that you would like to reach out. There we go. But thank you again for the time today and for lasting this long at the conference. The last day is always difficult. We had to fight very hard for this time slot. So thank you for making it through with us.
The biggest barriers to getting into counseling? Well, if you're on Medicaid, the current managed care contract makes it very difficult to get access to counseling. Optum is currently the contract that holds that with Medicaid. And I can only speak to people with intellectual and developmental disabilities, and that is that oftentimes the necessary therapeutic treatment isn't approved by Optum. So that's a barrier. The other issue that we worked very hard to try and develop capacity was that people in the counseling profession didn't necessarily have the skill set to support people with intellectual and developmental disabilities. So we invested heavily in training for counselors that we did statewide over 3 years to try and bring those skills to them in a week-long training that we did with a woman by the name of Julie Brown from Massachusetts. And there's still a need to continue that training to develop the skill set. And then honestly, everybody needs to be an advocate for Medicaid expansion, because Medicaid expansion is the one place where people with serious mental illness can get some preventative services where they weren't able to before Medicaid expansion. So Medicaid expansion was the one greatest thing that we did for people with serious mental illness in our state. So that will be under attack in this next legislative session. We need every advocate on hand to try and keep that in place so that people can access preventative health care that wouldn't be able to otherwise.
And this is Dana, and just to follow up with Christine, I think that's one of the, I focus mostly on ADA and technical assistance, but I can tell you, I get calls all the time for people that don't fall under Medicaid expansion, and then their employer doesn't have insurance for them to get help. So it's really, really difficult to find find resources for people. And then personally, when I have been to a counselor when I was younger, they focused more on my disability and not on the issue. And that was a really big issue. And over the years, I've grown very self-confident. And I just, it just blew me away how incompetent some of the counselors were with the ability to focus on the issue and not on the disability.
That is so true, Dana. And that is also a barrier to counseling for people with intellectual and developmental disabilities. The system wants to blame every barrier to integration that an individual might be experiencing on their developmental disability. And what we know is that about 85% of all adults with an intellectual and developmental disability also experience a mental health diagnosis. And the system just does not want to acknowledge that people with a developmental disability also have a mental health diagnosis that is oftentimes what is in most need of being supported and not necessarily the developmental disability. Another question was, what sort of programming is there for education, like you were talking about, Christine, around healthy sexuality, boundaries, etc.? Is there anything that has been developed that is specifically for individuals with disabilities? Well, I'm so glad that you asked that, Tracy DeMarcus, because of some of the work that we're doing. We are working with individuals with intellectual and developmental disabilities and family members to develop that training right now. We're doing that through the Administration on Community Living grant. Those will be done in person and with video. So if we ever have another pandemic, we can still continue to do the training through video, but also we know that best practice for people with intellectual and developmental disabilities is to do things in person. That works far better for learning outcomes and to be able to make that connection to people. And oftentimes, I'll tell you that every time I do a training on sexuality and boundaries for people with intellectual and developmental disabilities, what ends up happening, and I've told Bryan this to prepare for something that I've asked him to do in the future, is that people start talking about their abuse. So we always have to have social workers in the room to help people through that, because they can't connect a healthy sexual relationship because they haven't healed from the abuse that they've experienced in the past. And so it consistently comes up time and time again. And it's very difficult to move forward to think about like a healthy relationship when you've had all these other horrible things happen in your past. So
yeah. Can I ask a follow-up question?
Yeah.
How is this supposed to be utilized, the curriculum or the lessons that you're putting together? Like, are you looking to maybe partner with, like, I work for a domestic violence organization and we do a lot of, really traditional, like, educational programming, but something like that could be really great.
I absolutely think, we're just like, who wants to work with us? Because the issues are so prevalent for all people with disabilities. We're talking people who are deaf, people with, I don't want to make it sound like people with intellectual and developmental disabilities are the only people with disabilities experiencing abuse, because that is not the truth. And that's why we're doing the studies to study what's happening around all people with disabilities. But I think we'd be willing to partner with anybody who wants to work with us, because it's not a topic that people are banging our door down
right
to try and talk about. It's hard.
Yeah, well, call me. Bryan knows how to get in touch with me.
Okay, Bryan knows, then I know. Thank you for your question.
There are a few resources online. The Kansas Coalition does a really good job. I was trying to find it on there. They have done some curriculums just in the last month, actually, very new stuff. And then the collaboration that Christina mentioned, we're developing some healthy relationship tools and things like that through there. So more to come, basically, but we'll be in touch.
But again, we really believe that individuals should be the people teaching individuals. So we very much support that model. And so we think that really helps to have peer-to-peer training.
Okay, y'all, we'll watch the chat for a little bit more. Please go ahead and interrupt, pop in with questions. And then I know we did get the reminder about the evaluation. So please do that for the council. We appreciate it.
Can I ask Jonah a question? Jonah, I'm reading your comment in the chat, and I am new to the domestic violence world, so I don't always understand some of the language. And I'm wondering if you can help me understand there is a need for ongoing training. I'd like to see such training for domestic violence evaluators and OI providers. Can you help me understand that?
Offender intervention, also known as batter intervention programs. I have been a batter intervention supervisor and direct provider, and I have had batters in my program who have different disabilities, neurodiversity, physical disabilities of various kinds, and finding ways to make sure that that offender intervention is accessible to them, because ultimately this is about community and victim safety. And if we can't effectively interact with our offenders with different abilities and neurodiversity, then we're not doing what we need to do. And I think that from the intervention provider to the evaluator who makes the assessment and recommendation to the domestic violence court teams, we need education on how to interact with anyone, but also offenders who have disabilities.
Thank you,
And
Jonah.
I am visually impaired. I am a disabled individual myself in many ways, and learning it because it's happening to me right now. So,
Well, Jonah, I want to thank you for helping me understand and learn. I really appreciate it. And Bryan, do you know how to get a hold of Jonah?
I don't, but nice to meet you, Jonah. I'll drop.
I want to find Jonah again. So,
well, Christine, I actually sent you a connection request on LinkedIn.
oh, okay. I'll have to go there because I'm not a super good person about.
I could also just send you an email.
Yes, please do that. I'm horrible. I'm really horrible about LinkedIn.
And just one more time, there's our contact info if you need any additional conversations.
Nicole Rios, do you mind sending me an email?
Yeah, I can do that.
I would love, yes. Oh my gosh, this was better for me than any of you. I mean, I got more out of this than I think any of you got out of. Not from anything I had to say.
Yeah, I'm very open to doing, to helping to meet the needs of individuals with disabilities in our community. So
Wow.
anything I can do.
This all goes back to what Bryan said about relationships matter, and like, look at all the learning that's, I'm super excited.
All right, I will pop this down again, but hope to hear from you all. Christine, Dan, any last thoughts to send us out into the world?
I just am sincerely grateful to have you here. I know it's the last session. It's been a week-long conference, and I appreciate that you chose to spend your time with us.
Thank you.